Good morning, everyone. Today, I'll be presenting a summary of the article titled Development of a Training Program for Professional Nurses in South Africa and Educational Response to the COVID-19 Pandemic. This study focuses on how South Africa developed a structured training program to equip nurses with the knowledge and skill needed to manage critical ill COVID-19 patients. The training was designed using the AD model, which stand for Analysis, Design, Development, Implementation, and Evaluation. The first issue, lack of specialized training during the COVID-19 pandemic. Many nurses were not adequately trained to handle critical ill patients. They lack proper understanding of infection control, PPE usage, and intensive care procedure. A study revealed that only about 42% of nurses felt confident in their COVID-19 knowledge compared to over 70 of doctors. This shows a clear gap in professional preparedness that need immediate attention. Second issue, high risk of infection. Nurses were among the most exposed group to infection, especially during high-risk procedure like intubation. The shortage of personal protective equipment and insufficient training on how to use it properly increased the risk even more. Many nurses also face long working hours and fatigue, which further reduce their ability to stay safe and alert. Third issue, emotional and psychosocial stress apart from physical risk. Nurses also suffer from emotional and psychological stress. They witness frequent patient death, face grief and trauma, and often lack access to mental health support. Some even experience stigma or avoidance from their own communities because they work in healthcare setting. The first solution, AD-based training program to address this issue, the researcher developed a training program using the AD model. The program included 6 modules focusing on infection control, respiratory management, psychosocial, supportive, and palliative care. The training combined case studies, video tutorial, and interactive assessment using Poll Everywhere, ensuring active learning and engagement. Second solution, blended learning approach because of lockdown restriction. The program was delivered through a blended learning method. It used Zoom for live session, a learning management system for self-study, and printed material for references. This made the program flexible, accessible, and suitable for nurses working across different provinces and busy schedule. Last solution, mental health and continuous support. A key component of the training was the inclusion of mental health and psychosocial care. Nurses were taught coping strategy, self-care practice, and how to manage emotional stress while caring for patients. Facilitator also provided ongoing mentoring and feedback that strengthened emotional resilience and professional confidence. In conclusion, this training program greatly improved nurses' knowledge, confidence, and ability to care for COVID-19 patients. The multifaceted and blended approach ensured wide participation and practical learning. The study also demonstrated that the AD model can be effectively applied to create responsive, high-quality care training in time of crisis. Lastly, it emphasized the importance of continuous education and mental health support for nurses both during and after a pandemic. Thank you for listening. This initiative not only helped South African nurses during COVID-19, but also provided a framework for future emergencies preparedness in healthcare.